Do you have an appointment today? Alright, it looks like I see you in the system. Looks like you're about 10 minutes early. No, that is completely okay. It actually gives me enough time to thank the sponsor of your visit and video today, June's Journey. Have you heard of that game before? Yes, so a lot of times patients will come in and immediately once the exam starts, they grab their phone, whether it's to listen to music, watch videos, or play games. Now, June's Journey is a mobile game that you can download on your device completely for free, and it provides not only a great distraction, but it completely helps you escape reality, which is good for an environment like this. Yes, exactly. The game is actually set in the 1920s, where you aim to find objects in order to solve a murder mystery. Now, you guys, the scenes in this game are absolutely beautiful and captivating, and whenever I get home from work, I immediately grab my phone right when I get into bed, because it not only provides a great mental stimulation, but also provides a very mellow environment that helps me relax right before I fall asleep. Honestly, when I was first introduced to this game, all I could think about was how it would help benefit my patients who need that distraction, who kind of seek it out. So if you are feeling anxious at all for today's visit, I would highly recommend downloading June's Journey. The link is in the description below, and it will provide a great distraction for you while hoping to ease your anxiety and just to help you relax. Yes, it is absolutely free to download on Android or iOS devices and even available on PC. It is absolutely my pleasure. I will have you take a seat right over there and we should be calling you for your exam shortly. No problem. See you later.
Yes.
Hello. How are you?
I'm good. How are you?
Good. My name is Leanna. I'm the PA who's going to be doing your exam
Nice
today.
to meet you,
Nice
Leanna.
to meet you. So you are new to the clinic, correct?
Yes.
All right. And since you are a new patient and I haven't met you before, I'm just going to be asking you some general questions. Have you ever been pregnant before?
Yes.
And how many times?
3.
All right. And 3 kids at home?
Yes.
All right. So no abortions or miscarriages?
Not that I know of.
Okay. And when was the first day of your last menstrual period?
Maybe about 2 weeks ago.
Okay. You get your periods every month?
Yes.
Very good. And how many days would you say they last?
Between 3 and 5 days.
Are they super painful or heavy, or would you just say
not at
normal?
all.
Okay. And are you on any forms of birth control at all?
No.
All right. Are there any medical conditions that I should be aware of?
No, I have no medical conditions.
Any allergies to medications at all?
I have no allergies.
Okay. Any surgical history?
I do have a C-section in 2016, and that was with my first child.
Okay.
And after that, I had 2 vaginals.
2 vaginals. Any complications with those deliveries at all?
No.
Okay.
I had a C-section because my water broke, and then I developed an infection, and also I was stagnant at 6 centimeters for the last 6 hours of my labor.
Okay.
And plus developing an infection, they said it would be better to go with a C-section.
Okay. All right. And do you smoke or drink at all?
Just occasional drinking.
Okay.
And no smoking.
All right. Any family history of breast, ovarian, or uterine cancer?
I am not sure, but I think my great-grandmother had breast cancer.
What side of the family?
My dad's side.
Okay. Now, more of a personal question. Are you currently sexually active?
Yes, I am.
All right. And are you single, relationship?
Married.
Okay. Male or female partner?
Male.
Okay. And have you ever had any history of contracting any form of sexually transmitted infection?
I don't think so.
Okay. And have you ever had a pap smear, the cervical cancer screening?
I've had a few.
Okay.
Yes.
And have any of them ever been abnormal to your knowledge?
To be honest, I think many years ago,
Okay.
I did receive a phone call from my previous OBGYN telling me that it was abnormal and they would like for me to come back in 6 months and repeat it.
Okay.
And I came back in 6 months and it was good.
Do you know roughly how old you were?
In my 20s.
Okay. And how old are you right now?
34.
All right. Do you know if you ever got the Gardasil vaccine, the HPV vaccine?
No.
Okay. All right. So today under your appointment list, you are here for an annual exam. Now, on top of that annual exam, are you having any concerns at all?
I just want to make sure that everything is good, is healthy.
Okay. Are you having any pelvic pain today?
No.
Any breast concerns today?
No.
Any vaginal concerns?
No. One thing that I've noticed is that about a week or two after my period stops, I'm getting this bleeding for about 24 to 48 hours. It's not too much, but it's not too light either. Like I do have to put a pad.
Okay. And how long has that been happening?
I would say for the last 3-4 months.
Is there pain when it happens, or it's just
no pain?
And then, is it spotting, or is it like menstrual bleeding? Like you feel like you're getting another period?
It feels like I'm getting another period, but it's definitely lighter than a period.
Okay.
And it's heavier than spotting. Very hard to describe, but it's definitely not spotting, but it's not as heavy as a period. Now, would it be red in color, or kind of more of a dark brown or a pink? Red.
Red. All right. So with that being said today, I will of course give you some privacy while I step out. If you would like, you could keep your t-shirt on and take off your bra for the breast exam, or you could put that gown on and kind of cover up with that, and then you'll get completely undressed waist out, and then I will give you this blue drape to lay it over your waist, just so you feel a bit more privacy. Now for the annual exam, we'll be doing a breast exam. I'll be pressing on your abdomen just to make sure I don't feel any masses and that you're not tender. And then we'll be doing the pelvic exam. Now during the pelvic exam, what I do is I take a device, it's called a speculum. This is what it looks like. It essentially will go into the vagina, as I'm sure you've probably already experienced before, and then we look to see if we can find your cervix, make sure there's no signs of infection, and then we will do the pap smear. I always like to specify that the pap smear is cervical cancer screening. It does not include screening for any other types of infection, although I can add certain types of STIs like gonorrhea and chlamydia screening. Would you like any STI screening today?
Yeah, of course.
Now for the STI screening, I can do a vaginosis panel for BV, yeast, and trick, and I can also add the gonorrhea, chlamydia to the pap. Did you want the blood work as well, if that was hepatitis, syphilis, and HIV?
Well, whatever you think it's necessary today.
Okay, for sure. Perfect. So I'll make sure that we have the appropriate swabs out for you. I will step out and then we can get started on your exam, okay?
Thank you.
You're so welcome. All right, I'm just going to grab some gloves. We're actually just going to start with vital signs today. Do you have any questions before I do that at all?
No.
Okay. You're not having any fever or chills today, right?
No.
Perfect. All right, let's actually start with just taking your temperature. Did you do anything fun for Memorial Day?
We just had a family over.
Very nice. So, okay, this is just going to go right underneath your tongue. Temper's perfect. just going to do a quick blood pressure check. Is there an arm preference that you have?
Yeah, you can use the left one.
Okay. And if you're comfortable with it, I'll actually have you rest your arm on me.
Yes.
Perfect. All right, blood pressure's very good. All right, I am just going to write your vital signs down. All right, perfect. So now we're going to get started with the breast exam. Okay, so now we're going to be starting with the breast exam. So you're comfortable with me doing it?
Yes.
Perfect. So we will start on this side of the breast first. I'm just going to move your gown if that's okay with you. And I'm just going to kind of start from up here. And you haven't noticed anything different with your breast?
No.
No abnormal discharge of the nipple, lumps, anything you felt?
No.
Okay. If you wouldn't mind raising this arm up for me. Very good. Do you do self-breast exams at all?
I do, especially in the shower.
Perfect. Yep. And no changes in the nipple inversion or anything like that?
No.
Good. All right, perfect. Now we'll move over to this side, similar situation. And I'll have you lift this arm up for me. Perfect. And you're not feeling any pain, right?
No.
All right, and both sides are symmetrical. Excellent. Breast exam is done. I'm going to have you lay back for me while we do the abdominal exam.
Okay.
So we'll get started on that. So we'll have your legs go that way and then your head go this way. And then I'm just going to press on you real quick, okay?
Okay.
Perfect. Just going to press on you here. No pain, right? No. And then I'll have you straighten your legs and we'll do the same exact thing. No pain?
No.
Very good. All right. So now I'm going to take the stirrups out and we'll get you in position for the pelvic exam.
Thank you.
You're welcome. Alrighty, I'm going to come along here. Okay. Just going to lift this a little bit, okay?
Okay.
Now, if you wouldn't mind extending your legs out as much as possible. Perfect. You are just going to feel my hands on the outside, okay?
Okay.
Just looking on the outside here, making sure I don't see any suspicious moles or lesions. Okay, outside exam is normal. So I'm going to try and use a small speculum, and if we have to go a little bit longer, I'll let you know, okay?
Okay.
put some lubricant on it for you.
Thank you.
You're very welcome. All right, you're going to feel some pressure here now, okay? Able to see your cervix. Everything looks very healthy. Are you noticing any vaginal itching by any chance?
Yeah, I would say that in the last few weeks it was kind of weird.
Okay. Have you noticed any like white clumpy discharge at all?
Definitely, yeah.
I'm only asking because it looks like you may have a yeast infection, but as part of the swabs that we're doing today, we'll also screen you for that today as well, okay?
Okay.
So this part here will be the pap smear. Now, like I said earlier, this is just for the cervical cancer screening. Gonna feel the first brush here. Done. You'll feel the second and last part of the pap. Pap is all complete. You still doing okay over there?
Yes.
Perfect. I'm just going to scrub these brushes together. All right. And that'll get sent out to the lab, okay?
Okay.
Now we'll do the vaginitis swab. All right, you're going to feel some. Perfect. We're going to send that test tube out as well. I am going to pull the speculum out now, okay? But hang real tight for me. Last part of the exam is just with my fingers to make sure I don't feel any masses or tenderness.
Okay.
All right. I'm going to put a little bit more lubricant. All right. And you're just going to let me know if you feel any pain, okay?
Yes.
Any pain when I do that?
No.
Perfect. All right. Your pelvic exam is done. I will have you sit upright if you can. Okay. So, I didn't see anything abnormal on your pelvic exam today. I didn't feel any masses or anything like that. I know you've been having that weird bleeding, so what I'm going to do is I'm going to put in some hormone labs for you to get it done at the hospital, just to make sure that there's no thyroid or prolactin disorder at all. And then, have you had a pelvic ultrasound recently?
No.
We'll also put an order in for a pelvic ultrasound just to make sure you don't have any cysts or anything else going on that we couldn't necessarily feel. I saw yeast on today's exam, so I'm going to send you the pill of diflucan to treat that for you. And then once your labs and your imaging comes back, I'll be sure to give you a call and we can kind of come up with a game plan, okay? All right. Do you have any questions at all?
No. Thank you.
You're so very welcome. I will send out the scripts and give it to the medical assistant. It was very, very nice meeting you, and I look forward to next year seeing you for your annual, but I'll be talking to you sooner to go over the labs, okay?
Perfect. Thank you so
All right,
much.
you're so very welcome. You have a good day.
You too.
Thank
Thanks.
you.